People often ask me what is a rheumatologist and how do rheumatologists vary from orthopaedic surgeons, and why do we want to be referred to a rheumatologist rather than to an orthopaedic surgeon who deals with bones and joints. The essential difference is that as a physician we don't do operations. We try and prevent unnecessary operations, and we can recognise when an operation is necessary and when referral to an orthopaedic surgeon is necessary. The sorts of conditions that a rheumatologist deals with can tend to be very varied. They can be structural, such as the muscles, the bones, the joints, but they can also be functional. We're really immunologists. We look at how the body's own defences can sometimes turn on an individual and create inflammation within the various organs of the body. So we don't just deal with conditions that are within the muscles and joints. We can deal with problems within the kidneys, the guts, the heart, the lungs, where our rheumatological conditions spill over. Conditions such as systemic lupus erythematosus, which is an inflammatory condition of a number of different structures within the body. We deal with fibrosis of the lungs that's generated from rheumatological inflammation. And we also deal with what's called vasculitis, which is where the blood vessels get inflamed, and the patient sometimes only knows that they feel ill. They can't localise that condition to any part of the body. We also deal with specific problems within the bones. So I'm a metabolic bone doctor, and I can deal with osteoporosis and some of the other conditions such as vitamin D deficiency that lead to weak muscles and fragile bones. We also have a number of other bone conditions that as rheumatologists we deal with. We're also familiar with the wear and tear of everyday life. So sports injuries, problems where you present with a painful shoulder, where you perhaps have been reaching over the back of the car to pick something up and your shoulder starts to become difficult and restricted and then starts to interfere with sleep patterns at night. We deal with twisted knees, with swollen knees, with feet and hands, and in fact all around the body, and in particular we deal with spinal pain, problems with the neck, the middle of the back and the low back, which are part of everyday life often, but when they start to interfere with the ability to work, to do things, to look after yourself, to sleep at night, they tend to need a rheumatologist to help. And sometimes it's as easy as doing a scan to check that there is nothing wrong and referring somebody to a physiotherapist, but sometimes more complicated things arise which we can recognise and diagnose and help you with treatments.